You are watching and listening to a presentation about test taking tips and skills by Stratton. The presentation objectives include increasing your understanding of the importance of test taking skills, improving your pre-test preparation routine, increasing your understanding of test question construction, and improving your post-test routine. So you may be asking, why is test taking so very important? And we know that in nursing school, there are a lot of different evaluation strategies that are used. And one of those evaluation strategies is tests. Tests can be used to determine how much you've learned, and they can also be used to evaluate your level of competence. Tests can be unit tests, they can be finals, or standardized exams that are used for benchmarking. Now, the big test that we talk about is the NCLEX. I'm going to shift your gears a little bit here and talk about a book by Dr. Belloc. Choke is the name of the book, and if you want to look it up, the whole reference is listed on the back slides under the reference section. But Dr. Belloc studies human performance, and basically she explains that by practicing your skill, whether it's in the classroom or on the field, when you practice your skill under stress and you become comfortable under stress using your skill, the methods that you use to succeed become more procedural and unconscious. So, if you're practicing using test-taking strategies more and more in stressful situations, you begin to subconsciously use those techniques. This allows you to devote more of your brain power to other areas when you encounter questions that you may not have a foundation for answering. You will naturally use the process of eliminating one answer or two answers in order to move on and answer the question to the best of your ability. Now, I'm sure that you remember the movie Jerry Maguire, where Tom Cruise and Cuba Gooding Jr. are shouting back and forth at each other, "Show me the money!" So let me instead show you the numbers. And I have to say that the numbers generally don't lie. Students who are high performers demonstrate higher levels of self-efficacy and test-taking skills. They have found a positive correlation between test-taking skills and GPA. And 50% or more of college students report having difficulty with test-taking. So all the more reason to improve important test-taking skills. I like to divide up working on test-taking skills into 3 phases: the pre-test, during the test, and the post-test. I think that sometimes students may have difficulty in one area and maybe not in the other 2 areas, or maybe all areas need work. So we'll divide them up and you can kind of reflect upon yourself and see where you need the work. So, improving your pre-test game. First and foremost, you have to properly prepare. This includes reading the assigned readings, completing any assignments that your instructor has asked you to complete, practice questions maybe that have been assigned or that you have found in the back of the chapter that might be helpful. Maybe that includes NCLEX questions. You have an NCLEX question book that you like to use as a study aid. Orman and Gaberson discuss using blueprints between faculty and students to communicate what will be on the exam. If you are lucky enough to have a faculty member that does this for you, they may do this with a blueprint. You may also use your objectives for the exam. And I suggest that you take those and you look at them concept by concept and ask yourself in your mind, what do I know about this concept? What do I know about this? And you can either write it out and answer it. You can concept or brain map it. But make sure that you thoroughly go through that list. And anything that you cannot answer thoroughly, you need to go back, reread, and reevaluate, and concept map or brain map or write out again. So the night before the exam, and I have to say, I am a big proponent of always being prepared. And I learned this the hard way. When I was an undergraduate student, I had, I would say, an extreme case of test anxiety. And I went through one class and I survived. And the next core class that I got to was chemistry. And I ended up with a really, really good instructor who recognized that I was having a little bit of a struggle. And she asked that I not come back to her class until I had completed a workshop over test anxiety in the student center. And although I felt as though I was being punished at the time, I have to say it was probably the best thing that anybody's ever done for me in my educational career. And in this class, it was basic things that I still do to this day. And it starts with the night before. I lay out all of my clothes. I make sure that everything is packed in my bag that I might possibly need, including pencils, pens, Scantron forms, scratch paper, books, whatever I feel like I might need, maybe even a snack. But I make sure that everything is ready. And sometimes if I'm really nervous, just to decrease my anxiety, I would actually put my bag in the car. Flip side of that, if I wake up late, everything's ready to go, and I know that I'm still going to have my best foot forward in getting out the door on time. You want to make sure that you eat a good meal. You want to make sure that you also get a full night's of sleep. Not sleeping before an exam and staying up to cram frequently does the opposite for you. Instead of actually making you more productive and increasing your knowledge, it's kind of wasted hours because you would be more better well served by sleeping instead of trying to cram. A lot of that material you're not going to remember anyway. And the day of the exam, you want to make sure, get up, eat a good breakfast, and you want to leave at least 30 minutes, I would say sometimes even an hour, depending on if there's a train maybe that comes during the time when you would normally be driving, but you want to leave early. And this will also be included on this slide, improving your test performance of that day. So like I said on the previous slide, you want to make sure that you arrive at least 30 minutes early. And this is twofold because first of all, it decreases your anxiety of running late, but it also makes sure that if you are allowed to pick your seat in the classroom during the exam, that you have a pretty good choice of picking where you're going to sit. So if you're distracted by people in front of you taking the exam, maybe they're flipping pages, maybe they're turning their exam in early, you can sit in the front of the classroom. So this allows you to really have first choice. You want to focus on deep breathing. Big breaths in through your nose, out through your mouth. This is calming and relaxing, and it can help refocus and recenter you. When you get your exam booklet, you want to do two things. If there are formulas that you need to remember, or little things, maybe mnemonics that you have also tried to memorize, make sure that you write those down if you're allowed to in the margin of your exam, or maybe on scratch paper that's handed out by the instructor. The most important thing with that exam is that you want to read all directions slowly and carefully. We know that when you get your exam, you really want to start going through and quickly reading everything, but you really want to slow down. This is really important. And you also want to make a note whether or not the questions are only on the front side of the paper or if they're on the front and the back. So make sure that you go through the exam and you know exactly how many questions are there. Now, some instructors will have a time limit for the exam. You kind of have to be careful with this one. If you're like me, you're kind of a math junkie and you like to take your minutes and you like to divide them for your questions. So I know exactly how many minutes I have, but my problem is where I go wrong is I will actually start subtracting and keeping track of the time, and that really takes time away from the exam. If you have trouble pacing yourself, maybe you do want to know about how much time you're going to need per question, especially if you have a really tight time limit. The most important thing that you want to do is try to stay relaxed. As I explained on a previous slide, Dr. Belloc says, when you're devoting brain power to being nervous and anxious, that's brain power that is supposed to be or more effectively devoted toward answering those questions. So try to stay calm and relaxed. And if you need to, you can always put the exam down, close your eyes, take a few big, deep breaths, refocus yourself, and go back to the exam. Now, this slide will give you specific test, or next slide, I'm introducing. You will have specific test-taking tips and strategies. The NCLEX is going to ask two different types of questions. There will be multiple choice questions and alternate format questions, which consist of maybe all that apply, potentially fill in the blank, and maybe some other alternate format items that we will address in a later slide. But right now, we're going to stay on multiple choice questions. So multiple choice questions are made up of three parts. The stem, there are distractors or options, and the correct answer, which is included in those options. The reason why you want to know exactly how and why questions are constructed is because if you better understand the construction of the question, you're going to be able to deconstruct the question and have a better chance at answering correctly. The first part of the question that we talked about of the three is the stem. The stem is the first part of the question, and it's actually going to be what asks the question. With the stem, you want to say to yourself, what is this question asking me? What do they want to know? Is there polarity of the question? Is the question asking me a positive thing, or is it saying, is there something negative, like never? The priority of the question. Is the question asking me what is the priority, such as first, initial, best, safest, most? And these, if it's determining priority, usually the word always, first, most, initial will be highlighted. If a question is asking priorities, that's where you can use your CABCs, consciousness, airway, breathing, circulation. You can use Maslow's hierarchy of needs to answer those things. And also, don't forget that there are priorities in safety and airway. So if it's asking a safety or airway question, those are also most important and will usually be priority. And then the question is going to ask who. Who is the central character of the STEM? Is it the patient? Is it the family member? Or is it the community? So make sure that your answer is reflecting what the stem is asking. And I want to go back and readdress polarity because I don't think I quite made that very clear. But polarity, the second thing down here, it can be either negative or positive, like I said. So we talked about the negative polarity includes words like not, except, never, avoid, contraindicated. And positive polarity is going to be words like always. And just like priority, those words should also be highlighted for you. If those words that include or ask about polarity or priority or even who, if they are not highlighted, and that is an important thing for you to understand, is that you need to highlight them yourself if you're allowed to do that. Okay, that will help you determine if your answer is answering the question that was asked. Okay. Okay, so we talked about there's distractors and then the correct answer, which those are your options, okay? So you're going to be asked questions, and then you need to try to figure out the best answer out of all of the options that are provided. Okay, so when looking at your options, you want to try to eliminate at least one, if not two, distractors. And I know a lot of students use QBank to help them study. And so QBank does also offer some test-taking advice and strategies. And one of those that they offer is that picking the right option or the correct answer is also a type of skill and an art. We know that when you have 4 multiple choice options, if you can eliminate one, you have increased your odds of answering the question correctly. Say that you eliminate 2 of the distractors. Well, then you have a 50-50 chance of answering the question correctly. So that's really what you want to try to do here. First of all, are there options there that just do not make sense? If there are, immediately you identify that distractor, it does not make sense, it does not match the question at all, go ahead and eliminate it, okay? We know that nursing is very patient-centered. So questions that are not patient-centered or answers, that are not patient-centered probably are not going to be the right answer, especially if it doesn't answer or reflect the question that was asked in the STEM. So you want to identify patient-centered options. If they're not patient-centered, they're more than likely not the correct answer. You want to identify absolute words like always, never, all, everyone, and none. These included in the options, they should reflect what was also in the STEM. If these words are included in the option, more than likely it is not the correct answer to select because it is very exclusive. You want to identify opposites. Look at those opposites, and if there are opposites that exist, look back at the STEM and decide. Typically, opposites in this options are not going to be the correct answer. Identify similar options, and then look back at your STEM to see which one of those is reflective of the question being asked. And another thing to do is to look at options that are inclusive of other options. So, and we'll look at a couple of questions, but if one option includes the other options, that's going to be your correct answer because it's inclusive of those other options. Okay, continuing on with that, you also want to look and see if there's a duplicate distractor. So say there are 2 options that are basically answering the same way. Those you can eliminate. They are not the correct answer. And another way to eliminate a distractor is to identify options. Remember, like I said, nursing is very patient-centered. If they are not patient-centered or they do not support the patient, such as denying their feelings. You can eliminate that as well. That is not going to be the correct answer. Okay, so now we're going to practice. I'm sorry, let me flip that back. Okay, so here's a question for you. And I'll give you a second to read that question. The nurse is caring for a patient who has recently had a tracheostomy tube placed and is on a ventilator. While determining the best method of communication with the patient, the nurse notices it sounds like the patient is speaking. What is the first action of the nurse? Okay, so let's just look at the question, what we were going to call the STEM. What is the STEM asking us? Well, basically, we know that the question is patient-centered. We've got just the patient. We're talking about the patient. We also have the word best. We're going to determine the best method of communication. Is that what we're really asking in this STEM? Let's read on. While determining the best method of communication with the patient, the nurse notices it sounds like the patient is speaking. What is the first action of the nurse? Okay. So what's the first action of the nurse? We're going to be asked to prioritize first. So best was a pretty good distraction from first. So our STEM is asking, we're going to prioritize. What's the first action of the nurse? Okay. So this is option A, or 1. Oh, I'm sorry, that's the question. Okay, here we go. So here's the option 1. First option is to check the patient's oxygen saturation level. 2 is to locate the obturator to reinsert the trach tube. Well, I mean, right now I can tell you that kind of seems, I'm not really sure that's a good answer because, but it's probably a good distractor because we don't know that the tracheostomy tube has been removed. Immediately notify respiratory therapist and ask them to assess the patient. Well, we are the nurse and we assess the patient, so that's obviously not going to be the answer out of the distractors. Ensure that the cuff on the tracheostomy tube is inflated. Okay, so when we look back at it, we're looking at priority. So what's the first action of the nurse? I've got consciousness, airway, breathing, and circulation. So out of that list, I'm looking to see consciousness, airway, breathing, circulation. Okay. Are there any of these options that are inclusive of the others? No. Are there opposites on this list? No. Are there some that I can immediately eliminate because they definitely are not the right answer? Absolutely. There's nothing in here that says that the trach tube has been removed. So I'm going to immediately cross out, locate the obturator to reinsert the tracheostomy tube. I'm also going to eliminate notifying the respiratory therapist because I am the nurse and I am assessing the patient. So I'm going to eliminate those two. Now I have a 50-50 chance of getting this correct. So check the patient's oxygen saturation level or ensure that the cuff on the trach tube is inflated. Okay, first. Well, I know that the trach tube, the cuff on there, is a nursing responsibility. And I also know that if it's deflated, that allows air to leak around the cuff, allowing the patient to speak. If I check the patient's oxygen saturation level, that's going to be not first because first is airway. So I'm going to pick option 4. Although check the patient's oxygen saturation level is important, the trach tube inflation on the cuff is priority. Okay. Okay, so my suggestion is to go back, find NCLEX questions, and to go through them just as you would with those techniques. But now we're going to move on to alternate format items. Okay, so alternate format items. The NCLEX is also made up of alternate format items. And we know that the National Council of State Boards of Nursing, they explained that alternate format items on the NCLEX can include multiple response, fill in the blank, calculation, ordered responses, and or hotspots. And these items will include charts, tables, graphics, sounds, and videos. So make sure when you are practicing those NCLEX questions that you're using those techniques. And I would also say that when you're working with alternate format items, a lot of what you use for the multiple choice techniques are going to apply to the alternate format items when it comes to the multiple response. And what we're going to do is we're going to focus on the multiple response. Multiple response means that you have to identify 2 or more correct responses out of all of the options that are presented. You also have to identify all the correct answers in order to receive credit. So, the best option that you could do would be to use the multiple choice question test taking techniques in order to answer those questions. Okay, so when you get that question, you want to rephrase it in your head. You want to look to see if there's polarity, positive, negative. Determine the priority. What is the priority being asked? Use your clinical judgment. And ask who. So, in addition to that, you want to read the STEM very carefully. When you see select all that apply, that indicates that you'll be answering a multiple response question. And as I explained, you will definitely need to use those test-taking strategies that you develop for your multiple choice questions. Now, there are 2 different techniques that you can use, okay? Nugent and Vitale of 2016, they explained that there are 2 different techniques. The first one is to determine all the correct answers first, all the incorrect answers next, and then you use your test-taking strategies to rule out the rest. Or you can alternate between choosing 1 correct answer, 1 incorrect answer, until those that are left are the ones that you will need to use your test-taking strategies for. So, when you answer these questions, you need to develop on your own whether or not it's best for you to take all of the correct answers or you're going to alternate between correct and incorrect. And the only way that you're going to be able to determine this is to practice. So we will go on to practicing. And I'll give you a second to read that. Okay, so a nurse is going to assess a patient and concludes that the patient has a fluid volume deficit. Which assessments support this conclusion? Select all that apply. Okay, well, right now I know that this is an alternate format question. I'm going to be selecting all that apply. I know that I am the nurse. I am assessing the patient, who is the priority. And I know that we're talking about a fluid volume deficit. Fluid volume deficit. Which assessments support this conclusion? Well, what do I know about fluid volume deficit? Well, and you have a closed system, you don't have enough fluid. So you've got a system that's going to respond to that, and the response is going to be an increased heart rate to push around the fluid, probably going to have a decreased blood pressure because I don't have enough volume to meet the requirements. Dehydrated. A patient, it's going to be dehydrated. Decreased urine output and signs of dehydration. Okay, so let's look at our answers. Okay, right here. So I would say tenting of the skin, You've got your decreased interstitial and intracellular fluid, so that accounts for your tenting of your skin. Well, in our initial answering and response to the question, we talked about how there would be an increased pulse, so we know that decreased pulse is not correct. And a sudden weight loss, that is correct. The patient is fluid volume deficit, so they are going to have a weight loss. That's why we do I's and O's and daily weights. Increased blood pressure. Okay, well, we talked about that. So if we have a fluid volume deficit, we're going to have a decrease in the blood pressure. So that is not correct. We've got a decreased fluid volume, so there's definitely not an increase in blood pressure. Now, longitudinal furrows in the tongue. Okay, so that's going to require a little bit more of application type knowledge. So that one is correct because we know that there's a fluid shift to the intravascular area to maintain the cardiovascular function. We know that the heart is and the body is naturally going to increase some fluid so that we can maintain those vital organs like the heart and lungs and kidneys. So that is going to result in a tongue that becomes furrowed and very dry. Okay, very good. So once again, my suggestion to you is to play with these select all that apply questions. Really work on answering the questions, reading the rationales, and practice, practice, practice. Okay, so now moving on to improving your post-test performance. I think this is where a lot of reflection and learning comes into play. But you want to ask yourself, does my test score match what I perceived my knowledge level was? If I feel like I performed very poorly on an exam in which I was really prepared for, I need to figure out where I went wrong. Maybe it was in that I do not have a good grasp on test taking skills. I need to go back and practice. I am very uncomfortable with those select all that apply, and I'm going to go back and work on those. So if you recognize that you were very uncomfortable, maybe you were uncomfortable with certain content area, the best thing for you to do is to go back to your faculty member and to ask them. Technology these days allows instructors to look back and individualize the test results for a student. So you can say to that student, these objectives in the unit were not met, judging by the way you answered on the exam. Or I can say, hey, you know what, you have a big, what you do is you change your question or your response from being the correct response to the wrong response 25% of the time. Therefore, you need to quit changing your answers. Or I can say, look, it looks as though you have, you don't do so well with select all that apply. I recommend you go back and practice with those. So go to your instructor and communicate, because a lot of times they are the one that's going to be the best to guide you at what you need to move on from in order to make sure that your knowledge is matching your test score. Another question that you can ask yourself is, did you feel prepared for the type of test questions? And this reflects back to what I was saying with the first bullet point here. Maybe you had some calculation questions, and maybe you didn't put your calculator in your bag the night before. Make sure that if that's your roadblock or that was your big hurdle to overcome, that you do that. But if you're struggling with calculations, practice. It does you so much good to just practice. 10, 15 minutes a day, go in, do some practice questions every day. And what can you do to feel more prepared? Well, maybe I just have test anxiety and I need to work on that. Maybe I did not sleep well and I need to work on that. Maybe I didn't have time to read. Maybe I didn't feel like I had enough time to study. I have so much going on. Well, that is truth. And that is really the big hurdle with nursing school, is that it seems like you have 1,000 hours to cram into 10. So what I would suggest to you if you feel that way and it's becoming very overwhelming is to get a very good desk calendar. I'm not talking about the electronic kind. I'm talking about the paper kind that you can spread out and look at. What I suggest is that every day you document how many hours you spent studying for health assessment, how many hours you spent studying for foundations, how many hours did you study for pharmacology. Maybe maybe it was your birthday and you took a day off. Write that you didn't study any time during that day you had a celebration. At the end of that unit, or at the end of that time where you have studied the material for the exam, add up your hours. Go back and look and be very realistic. This is a calendar that's just for you. It's not to share with everybody. Go back and look. I only spent 5 hours studying for this pharmacology exam. I made a D on this exam. I think if I can put in 2 or 3 more hours, I can do it. And try to carve out throughout your day areas that you know you can eliminate so that you can study more for pharmacology. Maybe you devoted 20 hours to foundations, and foundations you have an A. Okay, well, I'm great in that class. Maybe I can shave off a couple of hours and put that into pharmacology. But I firmly believe that you're not going to be able to see that until it's actually on paper. And the next thing I would say about feeling prepared is go back, and if your instructor offers test review, do it. Maybe the test review is in the form of going back, looking up and providing rationales for certain content areas. Do it. Okay, maybe it's a type of remediation like that. It will always benefit you. But do it in a meaningful way, not just to get it done so that you can have a grade. And a lot of times now there are tools that are developed that are formal tools that are used for test analysis. And if your instructor offers that, definitely do that as well. Okay, it can only benefit you in the end. I alluded to a little bit of this in previous slides, test anxiety. And we know that test anxiety is caused by a couple of things: a fear of failure, a lack of preparation, or a poor test history. And the symptoms of that can be physical, emotional, or behavioral and cognitive, okay? And physical, you have an increased heart rate, you're sweating. It's basically signs of anxiety or stress. Emotional, you can feel, some people will even feel removed from their body. They will feel like the world is crashing in on them, okay? They feel like they can't concentrate. Behavioral and cognitive can be all types of things, but basically you just may have issues mentally focusing on that exam. And the problem is it can be a cycle. And that's what in the first bullet point, it says that poor test history. Maybe you have a bad exam and then you go back and you keep in this cycle of thinking that you're going to have another poor test result, and so it really becomes a cycle. But maybe you're one of those people who you're anxious because you know that you didn't prepare properly. So what do you do with a test anxiety? And the reason that this is included in this presentation is because faculty and your instructors should be doing as much as they can possibly do to prepare you for exams. And a lot of students, they're saying up to 40% will experience test anxiety. So we need to know what can we do about test anxiety, because it affects a lot of students. Now when you get to the NCLEX, we don't want you to have issues with test anxiety. So when you're practicing all these multiple choice questions and alternate test questions, you also want to really be conscious in your mind of things that you can do to reduce test anxiety. And the first thing you can do is to breathe. Big deep breaths in, big deep breaths out. will help to refocus and recenter your mind. Practice. That's been included throughout this presentation, but really practicing in order to make sure that you're properly prepared in every way. Once again, prepare properly. Exercise. A lot of people deal with anxiety by exercising. I would like to say that every person has plenty of time to exercise before an exam, but that's not exactly always the way it goes. But by exercising, your mind is focused on something else, and it gives your mind time to relax, so that when you're gearing up for an exam, your mind is able to have a break. The anxiety doesn't build. Exercise is very good in preventing a lot of anxiety behaviors. And eating right, okay? These are all things that you can do. Now, the biggest thing I believe that you can do to help with test anxiety is to change the pictures in your mind. When you have test anxiety and it's become a cycle, you are constantly thinking about what if I fail, what if I get a bad grade, I don't know the answer to this question, I'm going to fail this exam, and it continues on and on. The number one thing that I always explain to students is, first and foremost, you are who you are. The people that loved you before you took this exam will be the same people that love you after the exam, no matter what. And that is what is the most important. But you really need to work on changing the pictures in your head. And that's positive self-talk and being very positive in your mind about what's going to happen. Gosh, there's somebody out there who says, if you think that you can pass, you'll pass. If you think you're going to fail, you will fail. I'll have to figure out where that quote comes from. But part of taking a deep breath, part of exercising, part of sitting down before your exam is allowing you to have time to change the pictures in your mind. Focus on a positive test score. Focus on knowing that you know the content on the exam. If you don't know, you're going to use test-taking strategies to eliminate one distractor, two distractors, get down to a 50-50 chance, and then you're going to pick the correct answer. You're going to use the pictures in your head to focus on a calm, peaceful place in order to get rid of that anxiety, because that anxiety is taking up brain power that you need to focus on the exam that's coming. Okay, so work on changing the pictures in your head. And this doesn't always have to be exam related. It can be a life thing. And it's a really good thing to practice in general to change the pictures in your head. Okay, so we have reference. There's the book about, from Sean Blaylock that I was talking about, Choke. Very good, very, very good book. Especially if you have athletes too. It's a good book. And that concludes the presentation. Thank you.